Welcome to the regular update for pregnant women and families in Australia and New Zealand at the time of this COVID-19 pandemic. As you all know, things have taken a turn for the worse, with new outbreaks of COVID-19 infection in Victoria threatening to spread across our nation. The wake-up calls were not misplaced. We are far from being free of this viral pandemic, and there could be worse to come. One piece of good news, we now have much better information on what COVID-19 infection means for pregnant women and their unborn babies. Our colleagues in the UK have now published their experience of the outcomes of COVID-19 infection in pregnancy at a whole of population level in Britain. They have a universal healthcare system, as we do in Australia, so their experience contains very valuable lessons for us. Over the period from 1st of March to 14th of April this year, they obtained full data from all of the 194 maternity hospitals in the UK. During that time, 630 pregnant women were admitted to hospital with symptoms of COVID-19 infection proven by laboratory testing. There were many important findings. First, 1 in 10 pregnant women admitted to hospital with COVID-19 infection needed admission to an intensive care unit for respiratory support, and 1 in 100 died. It had been thought from the very beginning of this pandemic that pregnant women are no more likely than the rest of the population to be able to be infected by this virus, and that remains the case. But it now appears likely that if women do get the infection while pregnant, the outcomes may be more severe due to changes in the immune system. Second, some groups of women are far more likely to get severe disease from COVID-19 infection. More than half the pregnant women admitted to hospital with COVID-19 were black or from an ethnic minority. A similar observation had been made in the United States, where it was thought that different access to high-quality healthcare may play a part. But in the UK, everyone has access to high-quality healthcare. Other factors may be contributing. 70% of all pregnant women admitted to hospital showing COVID-19 infection were overweight or obese, making this the single biggest risk factor. 40% were aged 35 years or more. A third had pre-existing comorbidities. Comorbidities are the presence of other medical problems in addition to the main primary condition, which in this case is COVID-19 infection. The main comorbidities were diabetes, high blood pressure, lung disease, heart disease, and cancer. And the risk of illness from this virus appears to be highest in the last trimester, that is, the last third of the pregnancy. The peak time was about 34 weeks. This is similar to the other coronaviruses that came before COVID-19, SARS and MERS. As a result, many women needed obstetric intervention and caesarean delivery to help them with their breathing. 60% were delivered by caesarean section and 12% had to be delivered preterm to help with the mother's breathing. A big question remains as to whether the virus can pass to the unborn baby from the mother. 1 in 20 babies born to mothers with COVID-19 infection was subsequently shown to be positive for COVID-19 virus, but actual infection of the newborn appears to be uncommon, and viral illness in the child is even rarer. These figures come from our colleagues in the UK and a sobering wake-up call for us here in Australia and New Zealand. They have confirmed that many women with COVID-19 infection in pregnancy will remain well, but some will become very sick and can die, even in the presence of a high-quality healthcare system. So, if you are pregnant, or if you live with someone who is pregnant, please follow the advice that is coming from our governments. Work hard at keeping away from high-risk situations such as crowded rooms and spaces. Maintain your personal space. Wash your hands frequently. Consider wearing a mask if you cannot avoid crowded situations. And get tested if you have any symptoms. That ends this update for pregnant women and their families. A link to the scientific paper describing the British experience can be found at the end of this video. It is open access, so feel free to download it. I will be back in 2 weeks with any further information or advice that has arisen. Until then, stay well. Thank you.